Hello guys, welcome back to my YouTube channel. I know it's been very long since I ever made a video. Sijui kama ni mashughuli ama ni nini. Si mashughuli. No, I don't have a reason. This year I've not made any video for you guys, and I'm really sorry. I promise to be consistent, by the way. It's not happening. Anyway guys, so it's been April. It's a cesarean section awareness month, and guys, what do you know? There are so many myths about cesarean section, and also some myths can also be true. Some myths namaanisha kuna ile kitu inatamiwa as a myth, but it's something that is real, so you have to get the right information. Okay guys, welcome back to your amazing health channel. It's Gentrix Tindy here, and I'm glad that you clicked that button. Please consider subscribing. Subscribe 1, subscribe 2, subscribe. Thank you so much for subscribing, and I promise you that I'll bring so many contents to you guys. So guys, cesarean section awareness month. Ini ile mwezi unafaa ujue something about cesarean section. Still, okay, not every woman goes through cesarean section, but each woman who has gone through cesarean section is a hero, because that woman went through that cesarean sections to bring a life, and you're a hero. Big up. How do they big up? Big up. How? Big up. I think I will not be a comedian. Anyway, just making fun here and there so that I can make this video interesting. Anyway, I've been good. I've not been ill. I've not been stressed. I've not been depressed. I've just been not having that time to make videos for you guys. But the hairstyle is still the same. Considering maybe I should just do locks for once. Yeah, will my village mother allow that? Anyway, we shall see about that. Okay guys, today I just want to talk a little bit about cesarean section. How you may find out how vile utajipata umeenda cesarean section. English. What to do, how to care for yourself, recovery period, all that. I wish I would have put something for you guys, but I will in my next video, which is soon, God willing. God willing, which is very soon. I just pray that God gives me strength to be doing videos for you guys. Okay, so when you just care cesarean section is a surgery. It's a surgery. Many people think that cesarean section is not it's like a minor. Cesarean section is a major surgery. Imagine ni layer 7 zinakatwa. That is a very major surgery that is done to deliver your baby. So cesarean sections zingine ni planned na zingine ni unplanned. Kama ni unplanned, of course, that is an emergency. Planned cesarean section in ile you've been going to clinics, and according to your progress or how you have been going to the clinics, daktari amekuona, midwife amekuona, and they have seen maybe there is something that is hindering you to go through normal delivery, and that's why you have to do a planned cesarean section. Most hospitals normally don't do a cesarean section due to tocophobia. Tocophobia ni kuogopa uchungu wa kuzaa. Tocophobia, fear of contractions. Most hospitals don't do CS due to tocophobia. A cesarean section must have a reason for it. If you want to do a cesarean section, you must have a reason for doing a cesarean section. So for a planned cesarean section, it can be conditions such as twin pregnancy. If you have twins, if you are anticipating to deliver twins, yeah, that is a twin pregnancy. And then we have high blood pressure that is not well managed or well monitored. High blood diabetes mellitus, DM, that is ugonjwa wa kisukari, that is not well managed. We have placenta previa, that is, how can I explain that? If the placenta is on the way of the cervix. We have which other reason? A prior cesarean section. Yes, those are the reasons that can make you do a planned cesarean section. And for an emergency cesarean section, you can have a very smooth pregnancy journey, come in labor, start laboring, and then something happens, something like fetal distress, mtoto akichoka, then we literally have to save the baby and take you for an emergency cesarean section. We have something that is called cord prolapse. Cord prolapse, now the cord is hanging down, it has prolapsed. Now if the cord has prolapsed and then we are having contractions, okay, let's imagine this is the cord and this is the head of the baby. It has prolapsed, and here we have a pelvic bone, by the way. So the cord has prolapsed and we're having contractions, so the baby is moving either, and the cord is here. What happens? The baby presses the cord and then cuts the supply. Of course, the cord supplies oxygen, blood, everything to the baby. So what happens when the supply is cut? Of course, the baby will not make it. That's why we go for an emergency cesarean section. What else makes us delayed second stage of labor? Delayed second stage of labor, ama prolonged second stage of labor. Hapa ni penye umepush 1 hour, umepush almost to the second hour. What happens is the baby gets tired, we start going into fetal distress, the mother gets tired, starts going to maternal distress, and then we have to save the situation by going to cesarean section. Which other thing have I not told you? Which other thing have I not told you? Yes, those are the things that can happen in department cesarean section. What happens during cesarean section? During cesarean section, you will have your surgeon, you will have your midwife, you will have your assistant surgeon, you will have your runner nurse, all of them will be there, your anesthetist. So the first thing that happens, we prepare you for the CS, you sign the papers, we do the preloading, we give you antibiotics, because CS, it's a surgery, it's exposing your layers, so you are at risk of infection, so we give you an antibiotic as a prophylaxis for that infection. In CS za siku hizi watu hawalalishi, we normally do a spinal anesthesia. We normally do a spinal anesthesia for you. So the anesthetist will do a spinal anesthesia. The process will begin when your baby gets out. Mtoto akitoka utamuona, you'll be able to see the sex, you'll be able to kujua amelia ama hajalia. You will see the baby literally. Kitu tu utaona, you will not be feeling what's going on until some hours later on your recovery. What happens again during CS? Yes, that's usually what happens during CS. During recovery period, most hospitals normally recommend that you lie flat on your stomach, or you lie flat without a pillow, not on your stomach, without a pillow. In recovery, you can breastfeed your baby. You can start breastfeeding, and of course, you start breastfeeding 1 hour before 1 hour elapses after delivery. You can breastfeed your baby, you'll be on fluids, you'll be on nilba oral, not eating anything. And when time comes, you'll start ambulating slowly by slowly. You'll be on pain meds during your hospital stay. You will be on antibiotics on your hospital stay. And when you go home, you will be monitored by the doctor every day. So after a cesarean section, you don't go home the next day. You take at least 3 days, that is 72 hours, so that you can go home. And then there are some hospitals that unajua after nafanyia surgery kuna hiyo bandage inawekwa hapo. There are some hospitals that remove the bandage after 24 hours, some when you're going home, and then the bandage is sprayed. Surely the kidonda is sprayed. When it's hiyo kidonda ikishakuwa sprayed, you stay for at least for some 5 minutes, unaacha hiyo spray inakauka. Hiyo spray ikikauka, my friends, you can take a shower. You can take a shower, but now you just shower, unacha maji na flow. And then you don't use the same towel that you've used to wipe yourself, to wipe the wound. You take another clean towel, you just tap on the wound. Kama hivi, hapo kwa wound. Unashikilia tumbo, of course tumbo itakuwa imelalaka hivi. Unashikilia tumbo hivi juu, you just tap on the wound, then kuna hiyo nini cream unapeonga ya kupaka, unapaka. Unaweza oga after cesarean section, after umesprayiwa. Sawa. I remember watu wanaka, actually even let me give you an example. Unajua in these hospitals, when you're a nurse, you don't know everything. Kuna places when unafika, it takes you long. Maybe you've been in another unit for so long. You don't know what's happening in maternity. Ukikuja maternity, unakuwa oriented. So mimi nilienda kufanya CS kama nini. I think nilikuwa nimekaa for long bila kufanya maternity. So what I knew ni mtu afai kuoga. And the people who were attending to me knew that I am a nurse and I know that I'm supposed to take a shower. And so they did explain to me that, yes, sasa mom, just like you explained to your clients. Sasa hiyo vile tumekuspray, ukienda home unaweza oga, utapaka. Even nobody did that. So I was going at home. Actually, I didn't shower for the first few days. I'm not ashamed to tell you that because I didn't know. So it's okay. But that's why everyone that I meet, I tell them everything, whether you are a MO, I tell them everything that I know because of my experience. Unaoga. At home. Okay, on your discharge, you'll be given discharge meds. Itakuwa painkillers, utakuwa na antibiotic ya some days, na hiyo cream ya kupaka hapo kwa kidonda. Love yourself, guys, when you go at home. Usijifanye sasa hero. You have gone through a cesarean sections, you are the hero there in the home. You want to cook, you want to carry the baby, you want to breastfeed, you want to go. No, you're not a hero. Wait for your surgery to heal. You see, imagine it's post-delivery, and then post-delivery people, even with normal delivery, people normally feel a lot of things. There is exhaustion, there is a lot of emotions, there's everything. Just let yourself relax to look. Unajua ukikuanga na mimba unakuanga umetafuta mtu wa kukusaidia. It's very unfortunate kama hautapata mtu wa kukusaidia by the time una deliver. But after cesarean section, even after normal delivery, the thing that you're supposed to be doing the most ni kubeba mtoto na kunyonyesha. Otherwise, any other thing you're not supposed to. Sasa wewe umeenda huko umejifanya wewe ndio hero, unaenda kubeba magic inaitwa aje liters drink ngapi? No. You are very doing harm to your bodies. What was I to tell you? Yes. Make sure you rest enough. When your baby sleeps, take a nap. Kwa sababu hawa watoto usiku pia sijua nakuanga na nini. Usiku sasa ndo masaa zao za mchana. When the baby sleeps, take a nap. Make sure you take a good nap. Make sure sio sasa unalala pe mtoto amelala 3 hours pia unalala 3 hours. Just take a nap, you feel good, wake up, take a shower, eat something. But don't go start doing, you see, I'm very strong, I can do this. No, that is not for you. Even after normal delivery, rest, ensure you're good. We normally say take at least 6 weeks of rest. If you take 6 weeks of rest, even after that, after normal delivery, you'll just be feeling like someone. But if you start working immediately, a lot of things will be in your mind. Utachoka, macho zako kila saa zitakuwa ziko na usingizi juu the time you're supposed to be sleeping, you're busy doing other things. Na pia hiyo kidonda inataka ku rest. Na sisi ati sasa ushinde umelala. You will wake up, you will move around. Ukiona sasa imeanza kufura, you will tafuta ka pillow that is heavy at least a little bit. When you sleep, you put your legs on it. And then life moves on very well. very smoothly. What am I forgetting to tell you? Am I forgetting to tell you? Guys, those mothers who have delivered through cesarean section, I normally say this conversation everywhere. Ati hawajui uchungu ya kupush mtoto. Wewe unajua uchungu ya cesarean section? Unajua? We should just respect each other. As long as mtu akona mtoto, that person did a lot, sacrificed a lot, that person went through a lot, and that person needs to be taken care of. Once after cesarean section, sijaambia jipatie 3 months if you can, so that you can start doing this heavy course. The heaviest thing you're supposed to carry is your baby. Sasa kama uko na mtoto mkubwa, acha tu mcheza tu na yeye. But the heaviest thing you're supposed to carry is the baby that you have delivered. Hizi vitu zingine. Otherwise, guys, I think I'll come back with this topic again in my next session. Actually, I'm planning to have a nutritionist to talk to us about nutrition that you're supposed to maintain in diabetes. I hope she'll get some time to come and talk to us. And then please subscribe, because some good news is coming on your way. You'll get some here and there information. Kama haitakutosha, so unaenda kwa Google, kwani si ndio? See you guys on my next video. I subscribe, like the video, share if you like it.